Hello everyone. Welcome to this live masterclass. I'm going to change my screen a little there. So we today are going to talk about your plantar fascia and is it frustrating you? So this is part of kind of a mini class series, but we're going to let this one be a masterclass because when I reached out and asked who had questions about really just orthopedic stuff going on, plantar fasciitis was like the number one thing. And everyone was like, oh my gosh, help me. And with it, it's kind of over a couple topics. Sorry, getting some messages there. So there's a few different dynamics and types of people that get it. So we're going to dive in. If you have questions and you're catching me while we're on live, put them over in the comments. I will be able to see those. I will do my best to directly answer those. I also have some pulled up on my phone of others that conversations were happening and they were asking for help. So we're going to dive in and do those. Let me slow down for a second. For those who don't know me, I am Dr. Shari Miller. I am an orthopedic physical therapist. I have spent the last 12 years helping runners specifically, and probably the last 9 mom runners, even more specifically, and just family, friends with like all the orthopedic stuff. So we're diving in. I know some of my viewers are like the pregnancy postpartum population. This can impact you for after. So if you're getting a notification, join us anyway. You might learn something helpful to help you along the way. So I am the owner of Athletity, and this is kind of my jam. I've been teaching this for a long time. I've treated, hundreds of cases of plantar fasciitis. I will fill you in with what I know from a professional side and then what I know from a personal and just like what works in life. So we are going to, I'll give you like this overview. We're going to talk about what is plantar fascia, like what even is that structure? We're going to talk about what is the itis with it? Like, what does that mean? We're going to talk about common signs. How do you know if you have plantar fasciitis? There's a lot of information on the internet. I'm going to help you siphon through some of that today. And like, what causes it? Because if you get it to go away, that's fabulous. But like, what made it start in the beginning so it doesn't come back and it doesn't happen again? So we will get into that. If we have any like broadcast error issues, I will send a message and we'll do a second one. But I'm thinking we're going to be good. Fingers crossed, technology, right? So we are also then going to talk about the steps of what you can do yourself to help yourself heal. And then if you do want to seek other extra help from other providers, I'm going to talk about like what an orthopedic MD can do, a primary care MD can do, what a PT can do that are a couple little things you can't do on your own. But a lot of this can do on your own. So let's dive right in. Let's go to what is the plantar fascia. So I've got part of Mr. Skeleton guy here. He is part of a skeleton that I've had for, 15 years or more than 15. So he's kind of in components and pieces. So I just figured we would bring just his leg so I can show you his foot. So here's your leg. I'm going to set up on my shoulder here. If you're looking at the bottom side, so here's this foot. If you look at the bottom side of your foot, from the heel and then to about here, it sometimes goes up further, but you have this connective tissue, which is like a thick, so you've got like connective tissue in your ears, right? And like cartilage in your nose, like similar, but a little bit different. That's on the bottom. So it's not the same as a tendon, but if you think tendinous in nature and how that looks, that gives you that better visual of visually what would that look like. So that's kind of through here, and it's a thick, broad band, lots of small fibers in it. And what it's going to do is its job is to help keep the load. So if, I'm going to bring my knee up here. If you're standing, and this is the inside of the foot, over here's the outside of the foot. So the inside of the foot, sometimes we like pronate in, right? And we get that flat foot. When we get that flat foot posture, sometimes our plantar fascia is basically unloading then. And then sometimes when we supinate and kind of come up with a higher arch here, it's creating tension. And as we walk, that structure is going back and forth between releasing and then holding tension. So one reason, and I'm going to kind of jump out of order, but since I've got this guy to demonstrate, one reason you wake up in the morning and all of a sudden you're so stiff and you're like, what in the world? I was sleeping. I wasn't doing anything. Why is sleeping causing me problems with my plantar fascia? Well, while you sleep, our foot's not up like this. No, we have the weight it covers, and we naturally are here. So that naturally shortens this little bit of tissue under our foot as we sleep, just with the natural weight of a sheet or a blanket. And then what happens is when you go to stand up, you're bringing it back into this position. And all of a sudden, you're doing that quick stretch on it, and your body's like, ooh, I don't like that. That is one reason why in the morning when you first wake up, all of a sudden, like that's when the majority of your symptoms can be. So we're going to talk about that in depth in a minute, but that's where your plantar fascia is. When it's itis, plantar fasciitis, itis simply means inflammation. There's a lot of research out there of is it an itis or is it an osis? OSIS. And honestly, like that's just a semantics debate in a way for the medical professionals. And some of that is there inflammation truly present there when it's a chronic condition that someone's been dealing with for, say, over 8 to 10 weeks? Because if there's not inflammation, do we need to use inflammation measures? And we'll get into that on your treatment options. And some of those are just band-aid options. So we're going to talk about that more in depth. So common signs that you have it. I started out already saying one of the most common signs is that first time you step out of bed and you start to walk. So you get out of bed and you want to walk into the bathroom. And you're like, oh my gosh, my foot hurts. It is so painful. For newer moms who are getting up in the middle of the night with babies, super common, that same thing. You're trying to get out of bed to respond to a crying baby in the middle of the night. And all of a sudden, like, you're like, I'm limping. I can't even like walk down the hallway to get my baby because my foot is so daggone painful. So it happens in those situations too. So some of that's because it's been a prolonged time kind of in that relaxed position. All of a sudden you're asking it to stretch back out. So that immediately out of bed symptom, that's a huge sign that medical professionals look for. The second thing is if you're standing on your feet all day. So say you're on a hard surface, say you work in an OR, say you work in a hospital, you work retail, you're in a like manufacturing or warehouse situation where it's a concrete floor and you're constantly on that. So those that know, I used to work with the military population. We'll get into shoe wear, but having a boot, a military boot, can often kind of throw you into this. And there's some styles of the boots that are better than others. I can give specifics for those in that population if it's like, hey, get me that information. And I will let you know which ones are better than others if you're willing to purchase some new boots. But standing your feet on that hard surface can definitely kind of trigger it for people. A change in your body weight. So it's been a crazy, like 1 or 2 years now. If your body weight's changed drastically, the load and stress and tension on your body is slightly different. And maybe your body's trying to handle that differently. So that can play a role too. Runners, if you increase your load or all of a sudden you go off and start a bunch of speed work, or you don't have a shoe that's properly bracing your foot and your heel is getting some extra some extra joint play moving side to side a bit within the shoe, you're going to be overworking some of those and you're going to end up irritating that and causing some issues. So we kind of talked about common signs with it, and we started to kind of talk a little bit about what causes it. Ultimately, with this, it is an overloading tissue issue. So you are overloading the tissue. Have you ever felt like you're just a little overworked from work? I'm sure you have. And all of a sudden, you're just feeling like that tired, you're overwhelmed, cranky, like little things just irritate you that normally wouldn't irritate you. Well, our tissues can kind of be that way too. If other muscles and other tissues are stiff and they're not doing their job, sometimes the plantar fascia is overworking and it's doing more people's job than just its own. So, say a coworker's been sick and you had to pick up their load on top of your load, and you were already feeling overworked. Yep, it's kind of how your plantar fascia feels. So, similar things, we need to find the strategies for ultimate success that are going to offload your plantar fascia. And we're going to get into offloading strategies and kind of those steps because there's a few categories that you can get into. So, what to do when you're rehabbing something, when you're taking care of a tissue, you can have someone else move you and fix you, or you yourself can move you and fix you. So, depending on your situation, you can either choose to go to someone who's going to kind of do it for you, or you can learn some steps to do it yourself. And I'm going to give you some of the kind of initial phase steps. Like, this is like our first couple steps that you take: step 1 up, step 2 up. You get things calmed down enough that you can tolerate, you can get through life, you can get through your day a little better. And then if you get down to that nitty gritty, then seek the extra help if you need. So what you want to do first, you're going to help out those tissues that are overworking. Second, you're going to regain some symmetry. Figure out what is off, what is doing too much, and then help your body to get that symmetry back again. Then we're going to talk about lifestyle factors. There are a lot of things you can change that can give you some quick little differences. And it can be things you do, and it can be like home self-care recovery. So we're going to talk about both realms of that so that you have a clear understanding. These are things that in the standard orthopedic physical therapy setting, honestly, there's not a lot of time to communicate this to others. And that was often my frustration in a high volume clinic that was like people scheduled constant, is there was no time to share all these things that could get huge progress and huge wins, versus the style of care one-on-one and small group that allows me to share all of this. So it's just a difference. And then caveat before I get into these steps, nothing today is specific medical advice. This is simply YouTube. I am just sharing information, and information is knowledgeable. Increase your knowledge, and then you can look and apply and assess your body and figure out what works for you and what you want to try and what you don't want to try. But there's no patient-provider relationship, none of that. Just get that little disclaimer out there. So let's briefly talk about the band-aids and the quick fixes. So you've likely heard about different treatment options for plantar fasciitis. Research shows there's a lot of variance in what actually works and what doesn't. So let's dive in there. I call these the band-aid fixes, honestly, because you might feel better using these things, but you're not solving the issue. So when something wears off, it's still probably going to be there, or it might come back even. So you get that temporary relief, but it's not like the be all end all, you know? I wish there was like one thing to be like, do this one thing only. And if there was one thing that was close to that, it'd be the regaining symmetry within your body. But there's so much you can do, and I'm excited to share it. So if you've heard of injections for plantar fasciitis, corticosteroid injections, orthopedic medical doctors offer these. Some primary care physicians will offer these. Just know with corticosteroids, It's just decreasing inflammation. If you've had something for 10 weeks, 12 weeks, you're more into the chronic realm, you likely don't have as much inflammation that's causing it. So it's gonna have more of a Band-Aid effect. It's gonna be a toss-up of does it even help you? Um, and know that when you get more than 6 corticosteroid injections in an area, say a foot, ankle, similar region, there's a lot of research that shows it causes degeneration and breakdown of some of those tissues. So long-term longevity, you also want to weigh your pros and cons and make good, healthy, conscious decisions of what's right for you. There's another research study showing iontophoresis, which is basically a topical way to deliver a medicine called dexamethasone. It's basically an anti-inflammatory steroid that physical therapists can then use through a topical method. That's what the iontophoresis is, to deliver it through the skin. Now, the research shown on this, honestly, the one study was super small as far as participants. There was less than 25 people in each subject group, so the control group versus the other group. And with this study, what they did is they looked at kind of traditional treatment methods and then traditional methods plus iontophoresis with the dexamethasone. The people that had the iontophoresis, it did have faster results on pain relief. However, by 1 month, by 30 days, both groups were completely equal. So if you're only seeking out physical therapy for that, you got to kind of just weigh your choices. It is something as well to know that it was beneficial for, say, like athletes, or say you have a race coming up and you really need to like nip this in the bud, like get it calmed down so you can show up on race day. Like if you have a set date, a set thing that you need to show up and perform and feel fabulous for. So for my running crowd, like this might be something super important for you. Same with dry needling. Dry needling had similar outcomes to the corticosteroid shots. But people enjoyed the dry needling process more. Dry needling is not a technique that I do personally, but there are a lot of physical therapists out there that do. So if you're looking for that, you can call and ask somebody specifically if you're looking for it. Talking a bunch, I'm going to get a drink. Sorry. By the way, these are like my new favorite drink, just like super side note. The watermelon flavor is the best, in my humble opinion. Excuse me. So with these Band-Aid quick fixes, you're basically just applying something to see if you're getting some decreased inflammation and therefore some change. But it's an overloaded tissue. So if you're not changing the load and managing the load that's on it, it's not going to solve your ultimate issue, okay? Things you can do that besides PT, there are a lot of like the plantar flexion braces where basically it forces you up into dorsiflexion. So it forces your leg, say you're laying in bed sleeping, it forces you to stay in this position overnight. A lot of podiatrists really like these and prescribe the straps. It basically has a strap here to here that keeps your foot up. A large percentage of my population that I've treated over the last 12 years hate these, and they come in and they ask, do I really have to wear this? Like, because I kind of took it off in the middle of the night and like threw it across the room because I couldn't sleep and I just need sleep. So just know if you decide to invest in it, it's a toss-up. Some people are like, yeah, totally worked. But the large majority are usually like throwing it across the room at the wall. Totally honest. So besides that, let's get into helping the other tissues. So we talked about like the offload steps, and the 3 biggest ones are helping other tissues, regaining your symmetry, and then lifestyle factors. So let's get in. I feel like we've covered a lot. We're about 20 minutes in. Hope you're hanging okay with me. If you have questions, reach out, let me know. But right now, what we're going to go into is what can you do to make the other tissues feel better? And what tissues do you need to look at? Well, on your leg, so I'm going to put mine up here so you can see this guy a little bit better. So your calf muscles, okay, your calf muscles, one calf muscle called gastrocnemius, it has two heads, and it comes up and crosses above the knee and then comes down. Then your soleus is more, it's a deeper muscle and you see it more towards the sides. So I'll show you on my actual leg. So on the sides here, like say you're looking at somebody's foot this way, kind of the muscles here that sometimes you see stick out more, that's the soleus. And then the gastrocnemius is more here. Those muscle belly heads in the back, that's where you see like that curvature, more muscle definition for the calf muscles, right? So you have to stretch the calf both ways. And why does the calf matter? Well, the calf is what's in charge of pointing your toe down. So say you're pressing the gas pedal, that's the motion that does that. Well, say you're walking and you push off the ground, that's the muscle in charge. It attaches, it becomes very tendinous, comes down, it attaches and basically turns into your Achilles tendon. Achilles tendon, super common, everybody knows where that is. And then it kind of attaches and comes in underneath here, which comes and turns into like plantar fasciitis. Trying to think of a good example of, it's basically just a very broad fan-like connective tissue. But by stretching here, you are also going to be relieving some pressure here. There are a few things that can cause heel pain besides the plantar fasciitis, like bone spurs, things like that. That's where like your primary care, your ortho can differentiate, but honestly, a lot of the treatment is exactly the same. So you can kind of guide and follow off of what you think. And give some of these things a try, see if it helps you. If you get no luck, seek out specific help for your situation, or see an orthopedic doc and let them kind of tease out what might be going on in your case. So calf stretches are key. You want to stretch your calf with your knee straight and with your knee bent. That way you hit both of those. So your soleus muscle stretch, I have a specific YouTube video. I was going to demonstrate it today, but I do have a specific video with that. You're basically doing a calf stretch with a slight bend in your knee. So if you want like step-by-step, how do I do that? Look up that video under Athletity here under the channel, and you will find step-by-step how to do that. Gastrocnemius, how do I stretch my calf? There's a great video also on that here on the Athletity channel. So I'm going to try to keep our help today. I've got kind of my outline list for us to not take like 2 hours, because I totally can. So calf stretch, knee straight. My biggest advice that I give to people I help is to often put a belt or a towel by your bed and let yourself stretch this before you get out of bed, before you take those initial steps in the morning. Stretch that out. Make sure you're holding your stretch for a proper time. Sometimes we think we're counting to 30 and it's actually been like 10 seconds. So kind of measure your counting, make sure you're doing adequate, good, thorough stretches. Getting that loosened up before you're putting your full weight on it, your body will thank you. Because right now it's just in that I need a little TLC mode. If we can kind of give it a little hug, little TLC, a little stretch before it has to weight bear, you're going to notice a decrease in your pain all day long. You can also stretch the plantar fascia itself. I have a fabulous video of that already up. I will give you like a 5-second rundown, but if you want like a 2-minute explanation and full video, that's already on the channel. So you're gonna hold and brace at the heel, and you're gonna hold and brace like here. Think base of toes, okay? And you're gonna pull and stretch. And you wanna watch the angle of how your heel is moving. So stretch 1 is gastrocnemius, knee straight. Stretch 2 is calf stretch with your knee bent. 3 is the plantar fascia stretch. 4 is going to be, this is one most people don't give, but honestly for myself personally, like I have found it works the best. What you want to do is basically get down if you can. If this causes you pain, then you're not ready for it. But this is something that I find works personally for myself the most. Get into like a deep catcher squat. So when you're in this deep catcher squat, you want to watch your ankles though, because we'll use our little guy here. So this is the back of the leg. Sometimes what we do is, because we don't have this ankle motion here to be here and be straight. So if you're in kind of this deep catcher position, you're here. Sometimes what we do is we turn our foot out and we let our toes point out. So what you want to do is you want to make sure your toes are pointed in. And then when your toes are kind of pointed straight forward, not necessarily in, I should say, you want your toes pointed straight. If your toes are straight while you're in that deep squat position, that's going to help really stretch not only soleus, but you're getting the plantar fascia, you're getting in a weight-bearing loaded position, which is very functional. I'm a huge believer on function, function, function. Let's do things when we can, when it's tolerated, the way that our body performs in daily life, right? Because that's what we need the most. Okay, so that's kind of your 4 stretches, your 4 go-tos that you can do at home. And that's going to help your other tissues so they can decrease the load a little bit. Regaining symmetry, that is like right to left, figuring out where motions are restricted through the entire body and then where motions are not. So you can find where motions feel good and where they're loose, and you can actually turn and use those movements to heal the area that's not, that basically is the area of pain or the area of injury. This is something that I do and teach, kind of a big, long process. It doesn't take long to do, but it's longer than we're going to get into for the video. This is something I do on video sessions with patients. But basically regain that symmetry. You can test it out yourself and see, is there a hamstring difference right to left? Is there a difference in your low back flexibility left to right? This can be mobility. This can be moving your waist. How does it feel? This can be foot and toe things, moving your toes a certain direction and back up. And really a lot of right to left is something doing more work than not. Because how you pronate and supinate makes a difference too. And we're going to talk about that in lifestyle factors in just a second. So we're moving through our list. We're cranking through, guys. Thank you for hanging out this long. If you have questions, by the way, I'm going to pause quick because we're like 28 minutes in. If you have questions, feel free to email me at drshari@athletity.com or go to the website and let me know what your questions are. And I can try to help. If it can't be on video, we can discuss session-wise. Right now, licensure-wise, I'm limited to Ohio, but I can refer out if needed for like specific to you advice. So those are kind of your main stretches and exercises. Then and really, I guess I'm going to brace this under helping other tissues more than lifestyle factors. It's going to include a bunch of the recovery stuff under lifestyle, but I think I'm going to leave that a little separate category. So recovery stuff you can do at home. I am sure you've heard of the classic, like freeze a water bottle in your freezer and roll your foot over it. Essentially, you're doing an ice massage. You're taking down some inflammation. If you've had this for a long time, though, you don't have to do it unless it's just like, hey, this is really soothing and it feels good to me. If it is, then keep it and go with it. But if it's not, just skip it. It's something that when you're in the early days, it's very helpful for. But a lot of my clients also like Epsom salt baths, Epsom salt soaks. For your feet, let yourself kind of feel like it's a spa day for my mamas out there. For the dads and the fellas, just Epsom salt, soak it, watch some football, feel tough, do your thing, do what works for you. But honestly, that can help make a difference too. Getting adequate sleep, your body will heal slower if it's not getting adequate sleep. Um, Also, managing your activity load. So, what I mean by this is an overload condition. So, it's like an overuse. It's been used more and more and more, and your body's trying to be like, hello, over here, over here. Like, I need you to stop. I need a little break. And it's trying to ask for a quick timeout. Are you going to give it that timeout or not? Obviously, like in a work situation, you can't just stop and sit down. If you are a mom busy chasing kids, you can't just be like, sorry, mom's got a timeout. Doesn't work that way either. Same thing if you're a runner and you have your training plan. Like there's changes you can do to your training plan, and you can adapt that better than the people who are in the situation of work-wise. So, what you can do with activity is a few things. If you can decrease the tension that you're feeling by some shoe choices, which we'll talk in lifestyle in a minute, that helps. If you're a runner, change how much you're doing. First, if it started with speed work, my number one thing is eliminate the speed work. Let yourself go slow. If you are a runner and you just started with mileage, but you haven't been running long, you're not necessarily training, perhaps you're doing couch to 5K. What you want to do then is maybe it just went too fast too soon for what your body was ready for. So take it back to a walk, get your daily symptoms gone or down before you add back in that running. Because when you're pushing off and running, you're getting more force generation than what you're doing just with walking. So let yourself choose a different mode of exercise while that calms down. It could be perhaps the elliptical might not bother you as much. Perhaps a stationary bike could be a good option. Walking, especially if it's flat terrain, you're probably better than if it's flat with hills, honestly, because the angles that you're putting your ankle and then the foot. So when you're looking at force application, that's going to make a difference for you. So I would tone that down if you're a runner. If you are a runner training for a race and you're in the long distance range, go ahead and cut. If you absolutely have to keep those longer distance miles in order to get to race day and you're worried about that, cut some of the maintenance runs out. Cut some of those shorter, just kind of maintenance distances out. So that varies based on what you're training for. If you're half marathon, that might be a lot of like 4 mile, 5 mile, 6 mile type runs midweek. Cut a couple of those out. Give yourself that recovery time. But at the same time, if you're having pain every single day, that is going to be different. If you're having pain with daily activity, you need to make adjustments with your run. And if you don't know how to do that, talk to either a running coach or physical therapist that is a running coach, and helps guide through that or has that expertise to kind of differentiate that for you, because that's going to look different based on what your goals are and what your timeline looks like, because race day gives us kind of that clear-cut deadline. For the non-runners who are simply looking at, hey, like I am working and I'm on my feet. What in the world can I do? Couple things that have helped a lot of people I've worked with. So this is quite a big array of people here that I've given this advice to that makes a big difference. Part of it is when you're standing on a hard surface and maybe like you just switched what you're doing at your job, maybe you switched departments, maybe you had some kind of modification. What is going to happen then is like your demands on your body day to day have changed. And sometimes it's sudden and your body's going to respond and be like, oh my gosh, what are we doing? So what you want to do is give yourself that break when you can. Obviously, sitting at work for most people, just not really an option. What you can do though is you can take a second pair of shoes and you can change your shoes at lunch. Sometimes just that switch from one pair and one posture of how your foot is held to a second that's slightly different midway through your day can be a game changer. If you're somebody that's not healthcare and maybe you're wearing sandals, flip-flops early in the day, if you at least at one point switch to a good solid gym shoe, like a running shoe, something with good solid support. And then say for like my nursing crowd that's out there, because one person who sent questions in prior, her situation was that she's a nurse and she's on her feet and it's kind of standing in one position all day long, and a little bit back and forth through recovery rooms, and stuff like that, but mostly standing in one position. There, you can sometimes shift your weight, but also you want to watch that you're not creating low back pains or creating other asymmetries. You can also, midway through your day, when you go into the bathroom, give yourself like 30 seconds to kind of stretch out your calf midway. Give yourself on your lunch break a quick stretch. You can do just the standard, even put your foot up against the wall, and do that stretch for a minute or so just to give that a break. But most people have a huge success rate with changing their shoes halfway through their day. It's just enough change to really offload and switch that around. So try that out, see if that helps, and give me some feedback. Let me know, either come back in the comments or shoot me a private message. Let me know how that works for you. And then, actually, while I'm talking about that, we've talked for quite a while now, and I haven't asked you that many questions. So I'm going to ask the question to put into the comments what thing you are going to try first that we've talked about, because we've talked about the stretching, we've talked about balancing and the symmetry. We've talked about like the getting extra sleep, getting extra rest. We've talked about stretching on rest breaks. We've talked about shoe change during lunch break. We've talked about modifying running training plans, being careful with speed work, especially being careful with hill work, decreasing kind of that load and volume. A lot of times it's the volume or it's the intensity that's getting you. For my population and crowd that's working and having problems, for you, it's the volume, it's the amount of hours, right? Like, you're like, man, I could be fine if it was like half day of work, but by the time I get done with a whole day, oh my gosh. So speaking of a whole day, what can you do? We talked about what you can do at lunch. Now, what could you do at the end of your day? That's where you can cycle in like the Epsom salt soak. That's where you can get some of your stretching program in of an evening. I would stretch minimum twice a day, maybe 3 times a day, depending on what the demands on your body are. And that's where you kind of have to see what you can integrate in and make work for you, okay? I'm trying to think what else for the after hour stuff. The Epsom salt soak and ice, it's kind of a toss up of what you prefer. It's kind of a deeper tissue. So let your body guide. I'm somebody that I hate ice. Unless it's like heat of summer, I absolutely hate ice. So let it be your judgment call. There's a lot of research on heat versus ice. There's separate videos on that if you're like super curious on like what is scientifically going on, what is causing this, what is best. Check the channel and I dive into those too, differently. But choose what works for you. Let's go into, so we talked helping other tissues. We talked about getting that symmetry. We talked about all those Band-Aid fixes. Let's go into those lifestyle factors that I've touched on and I've alluded to, but we haven't really dove into yet. So lifestyle factors. Sometimes poor shoe wear can cause it. So when we talked about causes, we talked about being overworked, but we didn't really talk about what causes. Sometimes a shoe difference can make it be overworked. So in the springtime, a lot of people get plantar fasciitis because we switch to our sandals. We kind of set our other shoes aside and we switch to our sandals, and that can be the cause in the spring. In the fall, it can be the cause of our boots. And a lot of times we bring out boots and we change our shoe wear, and it changes our foot posture, and that can play a role. For runners, it can be same thing seasonally. Do you need to basically replace your running shoes? Are they kind of worn out? Is the support not there as much? Look at those, because your shoe wear can be a big factor. One person I was speaking to shared that they had a 50% improvement just in their shoe wear. I will caution you, shoe wear is not a be all end all, but it can make a big difference. If you are not looking for like buying new shoes, if you don't want this huge investment, you feel like it's something temporary, like, hey, it flared up, just need to get it to calm down so I can go back to what I was doing. Consider looking at what's called a heel cup, or you can even look at a heel lift. So a heel cup is basically going to go, let's bring our skeleton dude back. Say this is your foot. A heel cup is basically going to kind of cup up around your heel. Really, this hand would show it better. Like this. It's going to go around this portion of your heel and let it sit in a little cushion spot, basically, while you are working on, just like if you have that pain with just putting your foot, like any pressure on it, that extra bit of absorption for force can really help. And you can consider that a heel lift, or if you have a shoe that naturally has a heel lift with it, meaning a little bit of a heel to it, that can be beneficial as well. So that shoe wear change is going to change how your foot's being held. And that's going to change how that heel kind of moves side to side within the shoe, because that's where you can get that little bit of motion. Doesn't seem like a big deal, but you do that little bit of motion upon hours on end, and you're talking about thousands and thousands of movements, and all of a sudden the body's like, oh, please do not do that anymore. So looking at a heel cup, or just even like a heel wedge lift, you can buy them to put into a shoe. Or like, for example, my Uggs have just a little bit of a heel separate of my boots that I wear in the fall and winter. And then same thing, sometimes a hiking boot can have a little bit of a difference. You're looking at the heel drop. So on the shoe, where's the toe versus the heel? Is it kind of elevated? With running shoes, it'll tell you what that heel drop is, of how many millimeters of a difference it is. Some of the heel rocker shoes are kind of like that. Skechers were the first ones with them. Now all the brands have different ones, and they have that. You don't really need a rocker bottom shoe. If you're someone that has a lot of chronic foot problems, perhaps, but I don't like long-term putting someone in that soft of a shoe constantly. Our body wants that natural feedback from the ground, and that natural input of where the ground is and where our foot is in space for proprioception. So only do the softness if you need to really offload while you're painful, but then I want you back in a fairly normal shoe. Now, a good supportive shoe, totally stick with. You don't have to throw that out the door. But shoe-wise, you want something that is going to help. So either when you're in this acute stage of hey, I'm just really in pain, what I want you to do is get something with a little bit of a lift in it. You can keep your normal shoes and add that heel lift, heel cup. You can go on Amazon, type those in, or wherever you prefer, and see what those are. Sometimes it's like a $10, $15 change. Or you can just look at a good supportive arch support type of shoe, and that's going to help take some of that pressure off so that the plantar fascia is not working so hard. If you want to go back to your normal shoe and you're like, I really love this other style, I don't want to give up my favorite shoes, totally understand. In that case, you can either look at an orthotic insert, or you can also look at strengthening those little muscles within the foot with some exercises of basically deep muscle strength exercises. And those are going to help you then be able to tolerate what it is that you want to work on, and get you that long-term change. And then lifestyle-wise, we talked about quite a few of the other things. Decreasing the activity load. is big though. So look through your life and it's like, where can I cut down a little bit of what I'm doing, even just temporarily? If it's not during work, where can you cut a little bit off? Rest is not like totally what you want, but at the same time, you do need to decrease a little bit of the tension when you can. And that's where a lot of these methods we've talked about are going to help give you that. And if you combine everything all together, you get some really good results. One other self care method I did not discuss is massage. Giving yourself a good, deep, not only calf massage, but also the bottom of your foot. So, both areas. Find those tender points. Really work on massaging them out. You can do trigger point and hold. You can work on massaging through those. But that hands on care, that manual, that feedback, sometimes they'll get things to relax, ease up. It's tender. So, don't push through pain. Pushing through pain is never your goal. You just want to simply help your tissues. And a lot of times that manual feedback, that massage, that soft tissue mobilization, trigger point feels really good. And let that be kind of a case for you. So we are most of the way through. I am going to pull up the questions that I had specifically and address those. I know I've given a very comprehensive class on what to do, what it is, what causes it, what a lot of your choices are. But let's make sure that we kind of reinforce, kind of give this overview. So even for those watching, I think these kinds of messages are super helpful to know. So this individual that was asking me was, it's somebody that is a nurse and has to stand in one position constantly. So I addressed this a little bit. But what can you do when you're consistently on your feet all day? The person's always stood as a nurse, but needing to be in like one spot consistently is the hard thing. So what you can do on this is when you have to be, and this can apply for like factory workers, other people where you're in like constantly one spot. Sometimes they'll allow you to have some cushions under in a operating ER type. A lot of medical settings you honestly cannot, because you can't bring other things into the room, sanitization and all of that. But you can shift your weight a little bit. So let's use our foot guide. So you may find too, pay attention, see and just observe for like a day. Do you put a lot of your weight into your heels? If so, kind of come up a little. Some of this could be, I know this individual is a mom and has had pregnancies. So a lot of times the mom posture can lead to how we're standing and putting weight into our heels. So what you want to check is if you stand up and you put your hands like right inside your hip bones here, okay? See, are you tilted? Are you tilted forward to where those hips, like if this was a cup of coffee, it would be like tipping forward? Or are they back and in a more neutral posture? Sometimes your hip position, how you're standing, is going to affect how your weight is on your foot. And if it's forcing all that weight into just the heel and not the rest of the rest of the foot's not doing any work. And the heel is taking everything. So just while your feet are stationary in one spot, gently move your legs forward. You'll notice if your pelvis makes you feel like, oh, I feel like I'm tipping over. If you feel that way, you're probably anteriorly rotated at the pelvis. Kind of squeeze your butt muscles, let your back almost kind of round, not all the way. You don't want to come all the way back to that rounded position, but let yourself come back to more of a neutral. Engage those ab muscles. Bring that belly button to the spine a little bit. You don't have to stand all day, belly button to spine. I'm not saying that. But you will likely find that bringing that positioning back shifts where your weight is within your feet. And you can also bring your feet, kind of your weight forward so it's more equal through the whole foot and not just the heel. And then we talked about that shoe change in the middle of the workday. I think that's super key. Definitely look at that. And okay, so that is all of that person's questions. Let me pull up this other. So this is the individual who was actually having like really, really good recovery and turnaround from having the shoe wear changed. And sometimes, especially if you're a runner, consider going, he's saying this in a way, consider checking the shoe running like companies, shoe wear companies. You don't always have to get assessed for your running gait because a lot of research has shown that doesn't matter anymore. However, they do have the higher tier, higher quality shoe. So look at that because what they sell online is a different quality. All right, so main questions for her were what kind of stretches to get rid of and how often should she do them? So with plantar fasciitis, you want to stretch multiple times through the day. So I like to say a minimum of 3 times a day. And you want to hold stretches. There's a lot of research out depending on what your objective is. But for this type of objective, I would hold a stretch anywhere from 30 seconds to 1 minute. And you want to do several times. I always tell everyone too, because symmetry is huge, stretch both sides. You don't want to stretch necessarily just one side and not the other. Go ahead and fit both in. If you're strapped for time, just do the side that hurts. But honestly, you can get a lot of benefit in. So there were 4 stretches. I briefly went through them in this video, but I want you to pull up on Athletity's page, and there's a very good tutorial, like how to videos on those stretches. So pull that up if you need and get that extra help so that like day by day you can follow that. So I feel like this has been a great masterclass. I appreciate you coming. Just for kind of recap, we talked about what the plantar fascia is, the common signs that you have it. It's very overuse type of overworked injury. And it turns chronic and stays chronic because so many people like don't know what to treat with it. They kind of throw the kitchen sink at it, so to speak, in the rehab world. But the biggest things are the activity load. And if you change your activity load, you change some of that. And the way you do that is just, is it going to be temporary or is it going to be kind of a permanent change based on what you're doing? And those are those band-aid fixes. And you have to look at what are your objectives and what's your situation, because every single person's situation is going to be different. These are a lot of, this is basically what I give in a big comprehensive program. If someone was going to self-treat, it would have all of these elements in it. And I would just have it programmed more specific and then discussed with the lifestyle differences very specifically. But these are the main components. These are what your choices are. And I hope this really helped you out. Give me some feedback in the comments. What's the number one thing that you learned or that you're going to take away from this? So hope you enjoyed it. I hope this was super valuable for you. I enjoy teaching and sharing the knowledge. And number one, I love helping people just get out of pain and do what it is that you love so you can stay active, you can stay healthy, you can be strong. And when you feel strong, you're confident and you can make a bigger impact in the world. So go out there, enjoy your day, and take note. Let's get a few of these things knocked out and let's get you feeling better. So have a great day and thanks for tuning in. Bye, everybody.